from KNS Chiropractic. You bought him, area chiropractor. Today I'm going to show you how we dry needle somebody that's having tennis elbow. Tennis elbows, pain in the elbow, pain through this area. Usually people don't come in here and tell me it's from tennis. It's from something else, doing something repetitively, something where your wrist is an extension. It's overuse of the forearm extensor muscles. So, Brad, tell them what's going on.
Yes, about 2 weeks ago, I had a really strong pain through the tendon here and came in and had my first dry needling session. And about 2 days later, it felt about 80% better. After that week, it did get to probably a little bit, I could feel the pain again, but in the past week, it's really improved, and I'm feeling about 90-95%.
Right. We were treating you in the beginning, and then you went away for a little bit, so we weren't able to continue his treatment. And last week we started up the treatment again. And what'd you say, 80?
About 90-95% now.
Good.
That's great.
So that's good. He's had a handful of treatments, 4 treatments or so. So I'm going to show you how we do this. It's a pretty quick treatment. With the dry needling here, let me show you. Come over here, Ray, real quick. It's these muscles here that are going into the elbow. These are your extensor muscles. They allow you to bring your wrist in this extended position. They allow you to bring your wrist up. So we see this in people that are twisting screwdrivers, people doing a lot of hammering, anything where your wrist is up. Even people in the computer. Yes, it can happen from tennis too. And what happens is you look completely normal, but you get this terrible pain in your elbow. Some days it feels worse, some days it feels better, but you can pick something up wrong or just do a subtle movement, twisting, and boom, you feel it. So this is what we're going to treat. What we're doing is we put these needles into the elbow, we find these tender spots, and that's the belly of the muscle. We're trying to break up these trigger points or little areas of muscle irritation to break them down, as well as get it into the tendon to help bring blood to the area to get that tissue to heal. So I'm going to wipe this down. I'm going to show you how we do this. You need a pillow under, you good? Okay. So, here's the elbow. We're going to find out what's tender. And I can feel it. I can feel this band sore there.
I can feel it.
Yeah. Right there. And I feel it's going all the way down. These extensor muscles, they go from here all the way down into the wrist. So a lot of people come in and they feel it back here where it's attaching to the bone. But the belly of that muscle is through this area. You feel it at the attachment point, but by relaxing this, by relaxing the muscle, it helps to take the pressure off of here. This, it's very hard to do a lot of treatment because there's not a lot of tissue here. You can do some ultrasound underwater or feel that. It's very, got some tight spots, and they're easy for me to feel, which is good because when you dry needle, a lot of it is being accurate and getting into the right spot. So we're going to use these 1-inch needles here. Real simple. I'll show you how we do it. And he was already on electrical stim. Sometimes we do ultrasound to this. And you can see the tendon jump a little bit too. And when we do ultrasound, that ultrasound's another type of treatment, brings blood flow to the area, reduces inflammation. He hasn't really needed that. We've just been doing electrical stim at first. And real simple, just going right into the belly of the muscle tender.
A little bit, not too bad.
You can hit some spots and it does make you want to jump a little bit. Okay, I'm just going to switch to a little bit of longer needle over here. This is a 1.5-inch needle. Just to get more into this deeper part. It's got a little more tissue here to get through. There you go. And 2 more. We will be done. And I'll do another video, show you how to do a little bit of home treatment for this too. Ooh yeah, that's really tight. Sore?
That's good.
Good? All right, gonna leave them in there for 10 minutes. We'll be back. See you in a minute. As a side note, I paint. These are my paintings. I will put a address of my website where you can take a look at my paintings. They're for sale. All right, we're gonna take them out. They've been in for 10 minutes. Very simple. It'll be boring for people to watch me take them out, but this is what we're gonna do. We will treat Brad, I don't know, another handful of treatments, probably for another week or so, and it should be good. I will do another video and show some home tips to do when somebody has tennis elbow. I'll show you the different types of braces that are that I have found beneficial for my patients, and hopefully he'll continue to do well. I'm sure he will, and we will see you in 2 weeks for another video. Have a great one. Remember, pain is not a lifestyle.